Hello guys, this is Audit and you're watching Medical Masterminds, and in this video we'll be talking about how to choose cough syrups. Now before choosing or before knowing about different types of cough syrups and their compositions, first we have to know the types of cough. Now there are two types of cough. One is dry cough and the another one is wet cough. So one is dry cough, or this is also known as non-productive cough. And another one is wet cough or productive cough. Okay. Now, what is dry cough? Dry cough is that cough in which mucous secretion is not occurring, and what is wet cough, where mucous secretion is occurring. Now let's first talk about dry cough. Now, if you are treating dry cough, the one component that should present in your cough syrup is dextromethorphan, right? Dextromethorphan. Now D for dextromethorphan, D for dry cough. Just remember it, right? Now, along with dry cough, if the person is suffering with allergic symptoms, right? If the person is suffering with allergic symptoms like runny nose or red eye or like that, then another component should present in your cough syrup along with dextromethorphan. It is known as antihistaminic group of drug, right? Antihistaminic group of drug, and examples are like chlorpheniramine, right? Chlorpheniramine, or maybe diphenhydramine, right? Diphenhydramine, right? If there is allergic symptoms occurring along with dry cough, then the serum must contain any of antihistaminic group of drug like chlorpheniramine or diphenhydramine. Now, along with these two, if the person is complaining of blocked nose, then the cough syrup must contain one extra composition. This can be phenylephrine, right? Phenylephrine, or there may be another component that may present in your cough syrup. It is known as pseudoephedrine. Right? Now let's recall. If the person is suffering from dry cough, the first component that should present in your cough syrup is dextromethorphan. If along with dry cough the patient is also suffering from allergic symptoms, then there must contain one antihistaminic group of drug. It may be chlorpheniramine or diphenhydramine. If the person is also suffering from blocked nose as well, then the composition must contain phenylephrine or pseudoephedrine. Now let's take one example of any cough syrup. Let's suppose there is a cough syrup named Ascoril D, right? Ascoril D. Now this Ascoril D contains dextromethorphan. That's why D is present in it. Another example, let's take of Ascoril D plus. This cough syrup contains dextromethorphan plus. That's why plus is given in the name. This plus is given for the other two components, right? Like the antihistaminic group of drug and phenylephrine, right? So this is all about dry cough. Now let's jump into wet cough. Now in wet cough, the cough syrup must contain one of the three components. It may be bromhexine or ambroxol or guaifenesin. the cough syrup must contain one of the three components, right? Now, what is the function of this three? The main function of this is to loosen the mucus, the thick mucus, right? Now, if the person is also suffering from, or there is a problem in breathing, right? There is if he is complaining of breathing troubles and all, then one of the extra component that you can add in that particular syrup is bronchodilators, right? If there is any breathing trouble, then one component that you can add is bronchodilator. Now, examples are like salbutamol, levosalbutamol, right? Examples are like salbutamol or levosalbutamol or terbutaline, right? These are the examples. Now, let's take one example of syrup. Let's take the example of ascoril LS. In this composition, there contains levosalbutamol, or you can also take the example of amrolites. So these are some of the examples. Now, two things just remember. First one is from dry cough. Now, dry cough is generally works as a cough suppressant, right? It works as a cough suppressant. Now, any cough suppressant work right on the brain center, right? Works on the brain center. Now, anything acting on the brain center actually make the person drowsy, right? The side effect is making the person drowsy. So this is one side effect of it. So after having this particular syrup, the person will feel sleepy, right? Drowsy, like that. There is another side effect from the wet cough. Now, these bronchodilators have some side effects. This actually works on the heart, so it actually increases the heart rate and causes palpitations. Another side effects may be sweating and so on. So these are the side effects of bronchodilator. If you are prescribing, or if you are giving bronchodilators to any person, and there is present bronchodilators in any composition of a syrup, then there must present this kind of symptoms. So don't worry, just tell the patient, right, that these kind of symptoms may arise. Don't scare. So this is the whole thing. So thank you guys. I hope you liked it. So please subscribe my channel and wait for the next video. Thank you.